Welcome to This Explainer. Today we're unraveling a pretty fascinating medical mystery, retinoblastoma. We're going to take a journey from spotting a silent, often totally overlooked sign in a child's eye, all the way to the incredible, cutting-edge therapies that are quite literally saving vision and saving lives today.
We're going to start off with a surprising fact. This silent threat is actually the most common intraocular malignancy in children, making up about 3% of all childhood cancers. It affects roughly 1 in 15,000 live births globally. Now, while that might sound relatively rare, it is fatal if left untreated, making early detection the absolute cornerstone of survival.
Okay, so here is our roadmap for today. We'll start by spotting the silent threat, then move to unlocking the RB1 gene, check out modern multimodal management, and wrap things up with saving vision and lives. Let's dive right in. Section 1, spotting the silent threat. Let's talk about those critical early warning signs.
You know, the really crucial point here is that something as simple as a family photograph can sometimes be the lifesaver. When a camera flash goes off, a healthy eye typically bounces back a red reflex, right? But with retinoblastoma, it bounces back this stark white glow. It's called Leukocoria, and it acts as the very first massive alarm bell for parents and pediatricians that something is fundamentally wrong inside the eye. Now, while leukocoria is the primary giveaway, strabismus, or eye misalignment, is the second most common sign. And this right here is exactly why early pediatric eye exams before age 5 are absolutely vital. Think about this. The average age of diagnosis is just 18 months, with 95% of cases caught by age 5. And if it progresses, it can show up as white, fluffy clouds in the eye called pseudohypopyon, or even mimic a nasty infection like sterile orbital cellulitis when a large tumor undergoes necrosis. And looking here, this brilliantly illustrates the stark visual reality of how this disease develops. It's wild to see how the tumor physically behaves. First, in image A, we've got exophytic growth, meaning it grows outward, pushing away from the vitreous cavity and causing fluid to build up under the retina. Then, flip that for image B, endophytic growth, where it literally grows inward, spilling these dangerous vitreous seeds right into the jelly of the eye. Moving to C and D, that's what happens when the disease really advances, causing severe pressure like neovascular glaucoma or massive inflammation. Section 2. Unlocking the RB1 gene. Time to dive into the genetic mechanics of this thing.
So what's really fascinating here is Knudsen's famous two-hit hypothesis, which explains this mechanism perfectly. Think of it like a double-locked door that you absolutely have to breach for the cancer to develop. A normal retinal cell requires 2 consecutive mutations, or hits, to transform into a malignant cell. Honestly, figuring out this pathway was a monumental leap in cancer genetics.
Notice the profound difference here between the two pathways. A germline or heritable mutation means the first hit is inherited and exists in literally every single cell of that child's body. They are essentially walking around with one lock already broken, right? This makes them super vulnerable not just to retinoblastoma in both eyes, but to secondary cancers later in life. On the flip side, the somatic, non-heritable mutation is an isolated event. Both hits just randomly occur in one single retinal cell, meaning the threat is totally confined to that one eye.
And tracking down this exact genetic address on the long arm of chromosome 13, specifically 13q, was the ultimate detective work that validated that whole two-hit hypothesis. You see, the RB1 gene is a tumor suppressor. Its entire job is to keep cell division in check. When mutations knock this gene out on chromosome 13q, the brakes are completely cut, and those retinal cells just multiply out of control.
All right, Section 3, Modern Multimodal Management. Let's explore how we actually target and treat this today.
This table beautifully breaks down our modern chemosurgery arsenal. It really shows how we've evolved to deliver targeted strikes right where the tumor lives. It's a highly customized multimodal approach now. Intravenous chemo is still the mainstay for standard cases, sure, but look at these specialized routes. Periocular injections give high local doses around the eye. Intraarterial sends drugs straight into the eye's blood supply. And intravitreal, that drops medication directly inside the eye for those floating tumors that the bloodstream literally can't reach.
Which leads us to this incredibly specialized procedure called intraarterial chemotherapy. Picture this. Doctors thread a microcatheter starting all the way down in the femoral artery in the patient's leg, navigating it up through the entire body, into the internal carotid artery, until it rests right at the tiny opening of the ophthalmic artery. It is just mind-blowing. This allows for a massive, direct chemical hit to the eye tumor while totally sparing the rest of the child's body from heavy, systemic chemotoxicity. But what if the tumor seeds break off and are just floating in the avascular vitreous jelly? Blood flow and our intraarterial chemo can't reach them there, so doctors have to inject the drugs directly into the eye itself. But there's a huge catch. Pulling the needle out could drag cancer cells outside the eye. No way we want that. So check out step 2 here. Doctors literally freeze the needle track using a triple freeze-thaw cryotherapy technique the instant after the injection. It physically traps the cancer inside the eye, safely neutralizing those floating seeds. And finally, Section 4, Saving Vision and Lives. Let's look at the triumphant outcomes. The visual proof here is simply astounding. On the left, you're looking at a massive threatening group E retinoblastoma. I mean, this tumor is so large, it occupies a huge portion of the globe, threatening imminent blindness and potential spread. But on the right, after cycles of that highly targeted intraarterial chemo we just talked about, the tumor is virtually obliterated. It's calcified and shrunk down into a harmless scar. Talk about a profound emotional and scientific payoff. And despite the heavy, terrifying nature of pediatric cancer, this single number brings massive hope. When caught and managed through these modern clinics, we are now achieving an incredible 98% life salvage rate. Seriously? And not only that, but we're seeing a 90% eye salvage rate and an 80% vision salvage rate. Make no mistake, this disease is eminently curable today. So I want to leave you with this provocative thought as we wrap up this explainer. We now have prenatal genetic screening capable of identifying the RB1 mutation even before a child is born, coupled with these blistering, highly targeted chemosurgery techniques that save eyes we once had to remove. Are we approaching an era where early detection doesn't just treat the disease, but causes it to lose its fatal grip entirely? Thank you so much for joining me on this deep dive. Keep learning, keep questioning, and I'll catch you in the next explainer.